One of the toughest things about psychological distress that it convinces us that we're alone, so it isolates us, and it convinces us that things are hopeless, and that can create a real cycle that we get trapped in. And one of the best ways of breaking that cycle is actually to reach out and to connect to others and to ask for help. One of the key ways that this stress is maintained is through automatic patterns. Um, get stuck in cycles. And when we look at the research, we're seeing that making small changes can have really significant and lasting effects. I think it's important to remember that the common pathway of anxiety and depression that they convince us to do things. So in depression, um, we are convinced to self-isolate and we are convinced to be inactive. So we have difficulty getting out of bed or we don't want to talk to anyone. So the most powerful way of breaking through that cycle of depression is actually to get active, exercise, to get out, as well as to connect with others. So to talk to someone, whether it is a peer or a professional. Now, anxiety convinces us to avoid things, to put off things, because it's about fear. And one of the most powerful ways of breaking through anxiety is to break down what we're scared of to smaller things, smaller steps, and then to face our fears. Because really, the only way of dealing with anxiety is to face your anxiety. And the only way of dealing with depression is to connect and to get active. So I encourage our students to look at the website. We have so much information, but to remember that you can make some really tiny changes. Things like taking a few minutes to practice mindfulness, taking a few minutes to exercise, sleeping better. That's a very big one. Reach out for help, connect. Small changes can make really, really lasting impacts, but also that they're not alone. One of the hardest things about having psychological distress is to feel that you are alone with it. And there's no reason in this community that a McGill student should feel alone with their suffering.